Hello, I'm Sergeant First Class Calvin Witt. I'm an anatomy and physiology instructor at the AMED Center and School, Fort Sam Houston, Texas. In today's laboratory, we're going to discuss the anatomy and physiology of the peripheral nervous system. Any nerve fiber which extends outside of the central nervous system is described as being a peripheral fiber that makes up peripheral nervous system. Today we're going to name many of the major nerves that make up the peripheral nervous system. To begin our discussion of the peripheral nerves, we're going to discuss the first 4 pairs of cervical nerves. They arise from the region in the cervical vertebrae of the neck. Those first 4 pairs of cervical nerves, anastomose, are joined together to form what is referred to as the cervical plexus. The cervical plexus is a network of nerves which innervates the musculature of the neck and the skin and muscle in the upper shoulder area. Also arising from the cervical plexus is the phrenic nerve. The phrenic nerve is the nerve that passes down and innervates the diaphragm. Moving down the vertebral column, the next spinal nerves to form a plexus come from C5 to T1. This is referred to as the brachial plexus. The brachial plexus innervates the musculature in the skin for the shoulder and upper extremity. To name the 5 major nerves that branch off of the cervical plexus, we're going to move to the area of the forearm, and in the forearm we will name these nerves. They are named according to the bone near which they lie. Beginning on the lateral aspect of the forearm, where the radius is located, is the nerve referred to as the radial nerve. The radial nerve lies alongside and parallel to the radius. On the medial aspect of the arm, or the inner aspect where the ulna is located, is the ulnar nerve. Between these 2 nerves lies a nerve identified as the median nerve. The other 2 nerves that are primary or major nerves from the brachial plexus are located proximal to this. We're going to identify them by tracing upward, beginning from the radial nerve. You trace the radial nerve upward to the area approximately where the armpit is located, and there is a branch that passes underneath the armpit and back to the underside of the scapula. This is the axillary or circumflex nerve. The other major nerve from the brachial plexus is the musculocutaneous nerve. To find the musculocutaneous nerve, we'll move upward along the median nerve, once again into the proximate area of the shoulder. The large branch which extends off of the median nerve is the musculocutaneous nerve. Musculocutaneous nerve innervates skin and musculature in the anterior of the arm. In the thoracic area of the vertebral column, the spinal nerves which exit there do not form a plexus, but they innervate at their own level the intercostal muscles and the skin in that area of the body. The next plexus that we encounter as we move down the vertebral column is going to be the lumbar plexus. The lumbar plexus is an anastomosis of nerves from L1 to approximately the L4 to L5 level of the vertebral column. These spinal nerves are braided together And the major nerve that arises from that lumbar plexus passes down the anterior of the leg. This is the femoral nerve. The femoral nerve innervates anterior and medial aspect of the thigh. Moving down the vertebral column from the lumbar plexus, we come to the area where the sacral vertebrae are, and there are 4 sacral nerves there from S1 to S4. This forms the plexus that's identified as the sacral plexus. The sacral plexus gives rise to the largest and longest nerve of the body, which is the sciatic nerve. The sciatic nerve passes down the posterior aspect of the leg and is identified as the sciatic nerve until it reaches the approximate level of the knee where the sciatic nerve bifurcates. The lateral aspect is referred to as the common peroneal. The common peroneal nerve then passes lower down into the leg where it once again bifurcates. The branch that goes toward the anterior surface of the leg is referred to as the superficial peroneal. The branch that is posterior from that passes deeper into the musculature of the leg is referred to as the deep peroneal. The other branch of the sciatic nerve that passes to the medial aspect of the lower leg is referred to as the tibial nerve. The tibial nerve passes down the posterior aspect of the leg and under the plantar surface of the foot. This concludes today's laboratory on the anatomy and physiology of the peripheral nervous system.